The next stage of the evaluation is the overall hands-on assessment. And at this stage, we're assessing muscle mass, both one side to the other, and overall muscle mass. Many times, atrophy of particular muscles will indicate certain joints might be affected. We're also assessing sensitivity, which may play into treatment options we might want to consider later. And we're making an overall first pass assessment of joints, joint thickening, joint effusion. Again, just getting an overall view of where the problems appear to be located. In order to assess muscle mass, you need to have some knowledge of anatomical landmarks. I start by assessing the muscle over the scapula. I know the spine of the scapula runs in this direction, so I place my fingers perpendicular to that and assess the supraspinatus and the infraspinatus. You should just be able to feel the spine of the scapula with muscle in front of it and behind it. I then move down and I put my thumb on the inside of the triceps and one finger on the outside. I do this on both sides, assessing the amount of muscle in the triceps, just moving my fingers back and forth to get a good assessment of the amount of muscle. Sometimes you want to rock the dog from side to side because a loaded muscle can feel different in volume to an unloaded muscle. The next thing I do is take the opportunity to run my hands over the elbow joint. You should be able to feel a dip between the olecranon and the lateral epicondyle. So I just run my hands down. If I can feel that dip, that's suggestive of the elbow being normal, or at least there not being significant effusion or thickening. Then my hands run down over the forelimb, assessing antebrachial muscle mass, and also taking the opportunity to assess whether there's any obvious thickening or effusion over the carpal joint. If I can feel the small bones, that would suggest there's no thickening, no effusion. Then I come back and start to assess the hind end musculature. I run my hands back and place my index finger on the inside of the quadriceps, my thumb on the outside. Generally, I'm sitting or standing behind the dog to do this, and I'm assessing muscle mass on both sides simultaneously at the same level, getting an idea of whether or not there is muscle atrophy on one side versus the other. After that, I swing my thumb back on the inside of the hamstrings, finger on the outside, and do the same assessment of muscle mass, comparing left to right, assessing the hamstrings there. Now, sometimes when I'm doing this, I'll actually close my eyes as I'm doing the palpation, because closing your eyes actually heightens your sense of touch, your ability to detect subtle differences in muscle mass. Next, I run my hands down over the stifle, feeling just on the inside there of the distal patellar ligament. If that feels nice and sharp and clear, that would be suggestive that the stifle is normal. And I'll also take the opportunity to feel the inside of the stifle, feeling for the presence of medial buttress, which we'll come back to later. I then run my hands down over the cranial tibial muscle, assessing muscle mass there, and finally make an assessment of whether there's any obvious effusion or thickening over the hock joint. So what we've done there is just get an overall idea of muscle mass throughout the body, and also where we have the opportunity, make an assessment of whether or not there's any obvious effusion or thickening associated with particular joints. The final aspect of this is to get an idea of whether or not there's any excessive sensitivity associated with palpation. And what I do here is just gently push my fingers into the muscles as I move across the body. And what I'm feeling for is fasciculation of the muscles and the skin underneath my fingers. That fasciculation is evidence of hypersensitivity, which might be indicative of a neuropathic-like pain state. And that will play into treatment options that you might want to consider later on.